undergraduates, what's up? Well, are you planning to prepare for your post-graduation entrance exam or you're planning to set your clinic up? Well, I have got another plan for you to add. This is the fellowship program after your graduation degree. Well, these fellowship programs are offered by multiple institutes in our country. The first one I am going to talk about is the MUHS-IDA fellowship program, the one offered by the Maharashtra University. These fellowships programs are usually spanning from 3 to 6 months, and they let you buck up your skills in multiple streams of dentistry, like the one offered in endodontics. As the name suggests, yes, they let you learn the microendodontics, or they let you use the loop microscope, and you get to learn that microscope use during endodontics. And they also let you learn the rotary endodontics, the use of apex locator, and probably they are going to let you observe and assist one of the endosurgery case, and the other one they offer usually fellowship in implantology. Some of the fellowships are not regular courses, they are module based, so that the program is such that in every month you have 4 to 5 days of class and hands-on, and the program is usually planned in 4 to 5 modules. And there is also the fellowship in implantology, which I was just talking about, yes, and also another fellowship offered by this MUHS-IDA is the fellowship in aesthetics dentistry, where they teach you about the laminates, veneers, inlays, onlays, and direct composites, then anterior tooth preparation, and the impression procedures in FPD, etc. Now, I am going to provide the links for all of the institutes, whichever I am going to talk about, in the description box. Just follow them. And coming to the next fellowship, which is offered by D.Y. Patil University. DPU or D.Y. Patil University, they also offer similar kind of fellowship program in contemporary endodontics and also in implantology. Now the fellowship which is offered is by the Asian Institute of Advanced Dentistry, which is in Hyderabad. They offer a full-time program spanning from general dentistry, where you have better exposure with patients, and also you get to learn all the basics of dentistry. And also they offer fellowship programs in implantology, then aesthetics and endodontics, etc. Now there is another fellowship which is offered by the Savita Dental College in Chennai. Now this fellowship program, they offer you the degree of FDS, or Fellows in Dental Surgery. These fellowship programs, compared to the earlier ones that I was talking about, are usually a little bit costlier, much more costlier basically. The fellowship programs are full-time courses. They range from anywhere between 2 years, 1.5 years to 2 years. Okay, now they offer fellowship in almost every discipline in dentistry. Like their fellowship is in general dentistry, which is also a full-time course, and they offer fellowship in fixed prosthodontics, removable prosthodontics. You get more exposure in fixed prosthesis. You get more exposure of patients. Also the same holds good for your removable prosthodontics. Then there is a fellowship offered by them in oral implantology, periodontics, where you get to learn the flap procedures, the lasers, etc. Now, what are the costs? Whatever I talked about earlier, the ones offered by Asian Institute of Advanced Dentistry, the courses usually start from 45,000, and the ones offered by D.Y. Patil are somewhere between 1 to 1.5 lakhs. And also these ones offered by Savita start from 3.5 lakhs per year, which is the fellowship in periodontics, and also they have fellowship program in orthodontics, which is of 2 years, and oral implantology basically, which is a course of probably 1 year. Now these are all, Savita offers all full-time courses. So once you have a clinic, you either have to leave the clinic in someone else's hand and then you have to join these programs, or if you are planning to go for any of the other fellowship programs that I talked about earlier, if they are module based, then you may take a leave of 5 days or 4 days a month and attend those courses. Now coming to the pros of these fellowship programs. These fellowship programs lets you buck up your skills in any of the discipline which you feel you need to sharpen for your clinical practice. And other than the courses that are offered by Savita, most of the fellowships are quite time savvy, because once you are planning for your postgraduate degree, you have to devote your time for your entrance exam, and once you don't get the seat of your choice or the discipline of your choice, you have to study again or choose a discipline which you somewhat may not like. So these fellowships, according to me, are quite time savvy and it lets you buck up your clinical skill. So if you are not planning to go in an academic way, if you are planning to stay in the clinical field only, then these fellowships are considered well enough, and these are quite money savvy also, because the course fee for postgraduate degree in a private dental college is quite higher as compared to that in a fellowship program such as these. And also, say you already have a clinic, like those dentists who already have their parents' clinic which is quite well established, or their elder siblings' clinic which is quite established. It's not difficult for them to get a good patient footfall. So for them, it's quite a quick way to learn different streams of dentistry and practice it in patients. Now the cons, well, if you want to go in an academic line like joining a college, you still remain a BDS and you still work as a lecturer. And also, one more thing you need to see is most of these fellowship programs that are there for dental graduates in our country, at least whatever I searched, they are not recognized by Dental Council of India. So you may learn these skills, you may apply them on your patients, but unfortunately you probably don't get to write it on your registration certificate. So this is one of them. Otherwise, if you ask about these programs, these are quite handy, as I told you, like for your clinical practices. So decide accordingly. Bye bye. I'll see you next time with something equally interesting.